8 signs of low immunity. Have you heard someone say or even said yourself, I have low immunity? But what does that really mean? In this video, I'll explain this common term I hear daily in my office. Oh, my immunity is low. So let's get to the facts. What signs and symptoms truly indicate low immunity and cause for concern? When do you need to take precautions due to low immunity? Sign 1. You get more severe infections that last longer. This is compared to people around you, like co-workers or family members. They recover from a cold in 5 days, while you take 10, 15, and still have symptoms, so it lasts much longer for you. Why compare to those close to you, not the general population? We know it could be the same causative agent, virus or bacteria, so we can compare recovery times with others. If you had no contact, it may be a different or more severe virus. This time can also vary. Compared to those around you, recurring illness is a red flag. Sign 2 of low immunity. Frequent infection complications. Common colds lead to otitis, sinusitis, or even pneumonia. Recurring pneumonia? Check your immune system. It's not normal. Well, this isn't normal. It's happening for a reason, and we need to look into low immunity. Sign number 3. Unusual infections from uncommon causes. For instance, some skin bacteria or fungi unexpectedly cause lung issues. Infections from rare pathogens, medically termed etiological agents, are a red flag. Why is this occurring? Most people don't get sick from these germs, but this person does. This is a major red flag, and their immunity needs to be investigated. Number 4, skin infections like fungi, but I'll highlight shingles, also known as herpes zoster. I'll show a photo to help you identify it more easily. Shingles can appear in people with weakened immune systems. Not everyone with shingles has low immunity, but it's often related. It could be due to prolonged stress or an immune issue that needs checking, especially in younger folks. So for skin infections, I'm emphasizing shingles here. Other fungal infections are common, which is why I'm focusing on shingles specifically. Have you ever seen or had shingles? Are you stressed? Have you checked your immunity? Share your experience here. I'm always curious, but it's a warning sign, of course. If you had it, as I said, it's not always a serious problem. In medicine, doctors rarely deal in absolutes of 100% or 0%. Often signs are clues leading to investigation and full diagnosis. Sign number 5 is a blood test indicator I want to highlight because these signs often appear before you get pneumonia or before you develop a more serious infection. It's crucial to pay attention to these signs like changes in leukocytes. Low or high white blood cell counts can indicate immunity issues and need investigation. You okay? Many think only low white blood cell counts are worrying, but high counts can also affect immunity. So, changes in white blood cell levels are our body's defense cells. Why? Lower counts may make it harder to fight infections. When our bone marrow produces too many white cells, it could mean active infection or other immune issues. Got it? Always investigate if there's no clear reason for low or high white cell counts. Remember, some infections can lower white cell counts, okay? It doesn't always increase as people think. Number 6, you have high blood sugar levels. Why? What's blood sugar got to do with it? You've heard diabetics risk more severe infections. This confuses many people. They think diabetes alters immune cell counts. Diabetes doesn't change the count, but cell function. They may become less effective. Even with normal counts, high blood sugar needs treatment to boost immunity. That's why diabetics get more severe infections. Cells work differently. Even with normal counts, your body makes cells, but high blood sugar prevents it from fighting infections. Number 7, your vitamin D levels are low. We're learning more about vitamin D's functions. Beyond bone health and calcium absorption, it has other roles. One of these roles is vitamin D's impact on immunity. Studies link low vitamin D levels to infections. If you have risk factors like autoimmune diseases, being elderly, or bone issues like osteoporosis, we aim for a level of at least 30. Without risk factors, levels above 20 show no harm to immunity. Whether it's ideal or not is another discussion, but studies show without risk factors, it's over 20, with risk factors over 30. This is to ensure you have both classic and non-classic functions. There's a big controversy surrounding vitamin D, but I want to highlight that vitamin D levels above 80, especially 100, I've seen patients with 150 also carry a risk of toxicity. I've talked about this in a video, so I won't go into detail here. But it's not just the risk of kidney stones, but also arrhythmias. I'll link the video above and in the description if you want to watch it later, especially about vitamin D. But moving on to sign number 8, you have low vitamin B. Like vitamin D, vitamin B12 also plays a role in our immunity. Why? Our blood needs vitamin B12 to produce cells. Our bone marrow needs vitamin B12. It's one of its main functions. So if you have low levels, cell production can be impaired, including red blood cells. So anemia along with low immunity should be evaluated for vitamin B12 deficiency. Are there inflammatory markers? Inflammation is a hot topic now. People say that person is inflamed. Ever wonder what that means? I'll include other tests at point 8 for a more complete video, as they're crucial for understanding. So inflammatory markers exist. We can measure inflammation in the body. That's the simple explanation. What are these markers? C-reactive protein, erythrocyte sedimentation rate, ESR, or VHF, depending on where you're watching. Ferritin, uric acid, and fibrinogen can also indicate inflammation. When these markers are high, it requires investigation. Why is this happening? Why does this patient have high inflammatory markers? Of course, there are other causes. For instance, genetics can increase ferritin. Some autoimmune diseases or infections, if active, can increase your C-reactive protein levels. These tests are crucial in the investigation process. Remember, these inflammatory markers aren't usually part of routine screenings. They're not included in general population health checks. We need a specific suspicion to warrant this investigation. If you're feeling fine with no frequent infections or early signs, there's no need to check for low immunity. However, vitamin deficiencies I mentioned are routinely tested, okay? I'm specifically talking about inflammatory markers here. Other vitamin and mineral deficiencies like zinc, C or B6 can also affect immunity. If you have a balanced diet, you can get nutrients like vitamin C from your food. There'd be specific signs that would indicate these deficiencies. Want a video on vitamin C or zinc deficiency? Comment below and I'll make one. On a scale of 0 to 10, how would you rate this video? If it's a 10, I'll make more videos like this. Comment where you're watching from, which part of the world you're in. I'm speaking from Porto Alegre. Frequent infections can be a sign, but did you know UTIs often stem from habits? This has scientific backing and can reduce many urinary infections. If you have recurring UTIs, you should watch this video here. I'm sure it'll be helpful. It's packed with scientific information. Take care. See you next time.